My name is Drew Horowitz. I'm a clinical therapist, but my team and I at Horowitz Associates focus on intervention services. My agency has been providing clinical intervention services for over a decade, all throughout the country and also internationally. We have found a substantial amount of success in our process and our dedication to helping families navigate the process of recovery when their loved one is really unable to navigate it themselves. Intervention can oftentimes be overwhelming, scary, and confusing for family members. We take a lot of the burden off of you and onto us so that we can properly manage the situation and provide you with a really good option as to how to execute an intervention in a very effective and non-confrontational manner. I'd like to address some of the hesitation that families face when deciding if they should actually do an intervention or not. One of the major misconceptions of addiction, specifically in our culture in America, is that people need to sort of hit their bottom and self-initiate their own care in order for them to go to treatment and get well. And I think this is a very confusing and misleading philosophy, and I'd like to clarify. The vast majority of individuals with an addiction don't actually self-initiate and enroll themselves into a treatment facility. In fact, the majority of the population who are receiving care are actually nudged, pushed, and sometimes even forced into treatment through third parties, including clinicians, law enforcement, medical providers, or employers. It's almost the opposite, that the few and far between are self-initiating their own care. Therefore, it's really not ideal for individuals and families to wait for their loved one to bottom out. For all we know, that could be the end of their life, and we don't believe in allowing that to happen, and that being proactive and motivating them can be way more of an effective strategy than allowing them to go down some dark, dangerous scale to a place that could cost them their life. Another area of discrepancy I'd like to address is that individuals need to want to recover in order to go to treatment. Therefore, why would an intervention be effective if they are not asking for it? This is another widely misunderstood philosophy. There are two separate things: sustaining lifelong recovery from addiction and going to treatment. These are two very separate concepts that are not intertwined. With intervention, our goal is to get an individual to enroll and enter a treatment facility. At that time, it's in the treatment center's hands and that individual to decide if they move to this level or not. This is about all we have the ability to do as family and friends and professionals, and that's what intervention focuses on. The most wonderful thing is that a vast majority of people, once they get to treatment and they have an opportunity to stabilize, rest, eat, talk to professionals and other people who have been where they are at, oftentimes make this leap into committing to long-term recovery. So the idea that we need to wait until a person is fully ready to enter into long-term recovery in order to do anything is simply just false and not real, and it kills people every day. Intervention is designed to give them a moment to breathe, to rest, to get some clarity, where they can make an informed decision about lifelong recovery. And from the family's perspective, all we have to do is make this first step to get them there, which are two totally different things. Don't wait. Help people who are sick and struggling. Don't allow them to suffer. Sitting back and hoping and praying that they're gonna wake up and make a decision to call a treatment center and go get help is no way to live. Be proactive. Call me. Let's make a plan. Let's give them an opportunity to make a decision. We don't need to force them, but we can influence them and make a proposition that's appealing. I highly encourage that you look to a person like me to guide you through this very complex situation.